As a first-time mom, I got a lot of breastfeeding advice from every source possible. But being a midwife, I was able to differentiate between the fact and the myth.
Hello, my name is Lade. Welcome to Love My Baby Journey.
In this video, I'll be discussing the 3 most common breastfeeding myths I've heard, and I'll be telling you why they are false. Number 1, feed your baby formula post-birth because you have no milk. This is totally false. In the first 48 hours, your body produces a magical milk called colostrum. This magical milk is produced in small quantity. And women wonder why this is the case. And they ask if the colostrum is enough for their baby. The answer is yes. You see, in the first 48 hours, your baby's belly is as tiny as the size of a cherry, so they do not need gallons of milk. The function of the colostrum is to build your baby's immunity and prevent them from falling sick easily. Colostrum is so easy to digest that your baby will demand this milk every 2 to 3 hours. You see, the simple logic behind breastfeeding is demand equals supply. More demand from the breast, the more supply you produce. Number 2, breastfeeding can be used as contraception. Well, this is not totally true. Some breastfeeding moms experience what is known as lactation amenorrhea, which means delayed period associated with breastfeeding. Lactation amenorrhea method has been used as a contraception method since the 1970s. Now, according to the Breastfeeding Association, there are 3 guidelines you must meet before considering the LAM as an appropriate contraception method for you. Have your period returned? This includes any bleeding occurring on any 2 consecutive days in 2 months post-birth. Are you mixed feeding? That is, are you supplementing your breast milk with food or formula? Is your baby over the age of 6 months? If you answered yes to any of these options, then the LAM is not for you. You need to discuss with your family doctor about an appropriate contraception method for you. Number 3, stop breastfeeding once your baby starts walking. Well, children start to walk around 12 months. The fact is, from 12 months onward, your child's main nutrition should be derived from the family meal. But if you choose to continue to breastfeed past this age, there are lots of benefit from doing so. So what is the benefit for your toddler? Breastfeeding can soothe their toothache, pain from when they fall over, soothe them when they are unwell. So what do moms stand to gain from breastfeeding longer than 12 months? Well, research has shown that women that breastfeed for longer are at reduced risk of osteoporosis, reduced risk of breast cancer, at lower risk of anemia. Plus, women feel some sense of accomplishment. That's a good thing, right? To recap, you don't have to give formula to your baby unless medically indicated. Breastfeeding is not a total reliable source of contraception. Number 3, you don't have to stop breastfeeding once your child starts walking. Now, mom, it's your turn. What are the breastfeeding myths you've heard? Write it down below in the comment section. Thank you, and I'll see you later. Bye for now.